Bioidentical hormones are in the headlines a lot these days, and people are often confused about that, so I'm glad you asked. Bioidentical simply means a hormone that's an exact copy of something the body makes. So it's biologically identical to something that your body makes. And in this case, women are referring to hormones that are copies of what their ovaries have always made. That is confusing because it has been represented in a lot of consumer books that bioidentical hormones are better and safer than synthetic hormones. And there's a great deal of confusion about what this all means. But bioidentical hormones that you hear about in the popular press are often referring to compounded preparations that are made in a local pharmacy instead of products that are made by a large pharmaceutical company and manufactured and FDA approved and regulated. Now, the problem is that what many women don't realize, and unfortunately many doctors don't seem to realize, is that we do have FDA approved products that are molecular copies of the ovarian hormones estradiol and progesterone. The first FDA approved product for estradiol was approved in the United States in 1975. So this is not something that's new. It's not something that you can only get from a compounding pharmacy. These are FDA approved products that have been on the market in the United States for many, many years. They tend to be covered by insurance plans. They tend to be available at commercial pharmacies just like any other prescription medication. And all the fuss about it and all of the confusion about it came after the Women's Health Initiative, when women began to have more consumer books pointing out the problems of using horse estrogens like Premarin, or a horse estrogen and a synthetic progestin such as Prempro. And women became fearful of using that particular type of pharmaceutical product. So some books and some authors, many of whom are not medically sound in my opinion, have made claims that these specially compounded bioidentical hormones are safer and that they should always be used instead of commercial synthetic hormones, and that biologically specialized formulas based on saliva testing and compounded to a woman's needs prevent breast cancer and prevent Alzheimer's disease and are much safer than what women have been led to believe about hormones in general. And those claims are false. We don't have any studies that show that hormones, whether they're compounded in a pharmacy locally or whether they are manufactured, can actually prevent diseases like that. What we do have is a lot of information from good studies showing that the FDA approved products that are estradiol and progesterone, particularly if they're given as something that's not a pill but a patch or a gel, actually have lower risk than the horse-derived estrogens and synthetic progestin that were used in the Women's Health Initiative. So there is good data to show a better safety profile for the FDA-approved estradiol and progesterone products. And these are molecular copies of what our body has always made. I'll give you another example. We used to use thyroid derived from pigs. We used to use insulin derived from pigs and cows. And we had estrogens derived from horses. Well, as scientists became better at developing an exact copy of what the human body made, companies developed a human form of insulin, and that's the one that's primarily used today. We've developed molecular copies of the human form of thyroid hormones, and those are the products that are most often used for thyroid replacement. It's only in menopause that we're still using horse-derived estrogens, predominantly in the United States, a product that came on the market in 1942, and yet we have better options available that have gone through FDA approval and safety studies and effectiveness studies. The patches include Climera and Vivel, plus generic patches. And we have Estrogel and Divigel that are transdermal gels of estradiol. There's Femring as a vaginal ring. And these are all products that contain the same molecular copy that the human ovary always made for the estrogen. And I think that women will find, as my patients tell me day in and day out, that they feel better taking the form that their body's always made rather than taking the form that happens to be a mixture that the horse's body makes. So that's what we mean when we talk about bioidentical hormones. I think that's another example where it got completely confused in the press and the way it was presented. The FDA recent regulatory action and warning letters was aimed at compounding pharmacies that were making false and misleading claims for their compounded products and were using a type of estrogen called estriol, which is not the normal form found in a woman's body at most times of her life. Estriol is made by the placenta during pregnancy. And the FDA came down on these pharmacies that were making false claims for these products. They did not ban bioidentical hormones. In fact, as I've said, there are several FDA-approved products of estradiol and progesterone that are currently on the market and widely available at your regular corner drugstore.